Dr. Amanda Painter, physical therapist and fitness coach here. So what I want to talk about today is a couple of things that you can do to try and relieve some low back pain that you might be having, especially if it's kind of disc related, so like a herniated disc. So I'm going to go over two things. I'm going to give them in different positions. Please know this is not medical advice. If you're having increased discomfort or if your pain just doesn't go away for a long time, please follow up with a medical provider. But the first thing I'm going to start with is actually something to try and get the disc to almost move back in its normal spot a little bit. All of these should not cause pain. They should feel good. They should feel comfortable. If they increase pain, go ahead and stop. Either back off or stop. Feel free to comment, let me know, and I'm happy to give feedback. The first one you're going to do, you can do this laying down or you can do this standing. I'm going to show you the laying down version first. You can do this on a floor, on a bed, whatever's comfy. And basically you're going to take your hands and you're going to put them where mine are here. And I'm basically going to push up. So it's like I'm hinging at my back. And I'm going to come up and hold for about 5 to 10 seconds and then come back down. And then same thing. And then back down. If you want to make this a little bit more advanced, a little more intense, you can bring your arms like this and push up this way. So you can see how that angle is much different. So you can try that out. Do this for about 3 to 5 times a day. Do about 10 of them. Please don't overdo this. If you do about 200, you might be feeling it the next day. So the standing version of this is take your hands and you're kind of going to like place your hands around where your area of discomfort might be. And then it's like I'm going to hinge around where my hand is and I'm just going to lean back. Again, hold 5 to 10 seconds and then come back up. So that's the standing version of that. Then what you want to do is you want to kind of, especially if you've been having this for a long time, for 6 months, 5 years, things like that, you really want to get some of the muscles and tissues around the area to kind of relax. So I'm going to show you a stretch that you can do. I prefer the laying down version of this, but you can also do the sitting, so I'll show you both. The laying down version is you're going to take your leg, you're going to cross it like you're sitting figure 4, take your knee, and you're going to pull up and across. So I'm taking my right knee and pulling towards my left shoulder. And I'm going to relax my head as I do it, and you can pull with either arm, it doesn't really matter, and you're going to feel a stretch. And then what you can do is switch legs, and I'm going to show you where you can feel this. So again, I'm not going to pull across, I'm not going to pull up, I'm just going to pull diagonal. And you should feel this somewhere through here when you do this stretch. I want you to hold that for about 30 seconds. This one you can do 3 to 5 times a day. If you've got a sitting desk job, here's the sitting version. Take your leg, cross it, bring your knee up and across. Notice how I kind of shift to go sideways. Try and keep your shoulders pointed forward. Again, make sure you do this on both sides. You're going to feel it a little bit more intensely on one side. That's the other thing. I don't really want you to push into an intense stretch with this. I want you to get to where you start to feel something gentle, and that's your stopping point. If you go into that intense stretch, what's going to happen is your muscles are likely to kind of tighten in rebellion on you, and you might feel a little bit worse. So don't over pull either. So go ahead and give those a try. If you've got any questions, please feel free to let me know. If your pain's been there for a long time, please know that kind of like it's been there for a long time, your symptoms aren't going to miraculously go away overnight. So this does take some time. These are just some tips that I wanted to give you. And if you've got questions, let me know.